Hi guys, I'm Shauna Torbohm. I'm the current clinical practice educator for Royal Inland Hospital Emergency Department.
And I'm Brad Stroich. I'm the trauma nurse coordinator here at Royal Inland. Today we thought it'd be a good opportunity to talk about new product, Fibryga. So Fibryga, what is Fibryga and why are we having it? Fibryga is a powdered form of fibrinogen concentrate. It is now available in the region. It is replacing our cryoprecipitate in the blood bank. It is indicated for patients that are suffering from bleeding situations. So that could be hemorrhage from GI bleeds, or in our case, often trauma. So Fibryga is a really important component of our whole blood loss. So patients, when they're bleeding, are bleeding whole blood. When we are treating that, we want to treat them with the red cells, FFP, platelets if indicated, and then fibrinogen concentrate. So Fibryga is now replacing our cryoprecipitate, and is an important part of that trauma triad of death cascade of acidosis and hypothermia and coagulopathy. So replacing the fibrinogen will help address the coagulopathy component of that cascade.
All right, so now I'm going to talk to you guys about how we mix Fibryga and how we give it and the dosing we use for our patients. So unlike cryoprecipitate, which needs to be thawed, Fibryga is available to us quite quickly because it's in a powdered form. It will be sent to us from the blood bank in a container like this. Each of these boxes contains 1 gram of Fibryga. For our trauma patients, it is weight-based, and we can give up to 4 grams, so 4 boxes of Fibryga at one time. So each Fibryga box contains an Octajet transfer device, your powdered Fibryga, this is 1 gram in this glass vial, your sterile water, and a particle filter that you will attach to a 50 ml syringe that you will need to grab. And if we're cooling our Fibryga, so if we're giving more than 1 gram, there will be an empty sterile bag provided by blood services that you can then put the Fibryga in to infuse through your Baxter pump. Right, so if we get word that we need to give Fibryga to a patient, it can take a little bit of time to reconstitute. So I'm going to show you quickly how to go about doing that. So obviously you want to be as sterile as possible. You're going to pop the top off of your Fibryga vial as well as your sterile water vial. Cleanse the top with your alcohol swab. You grab your Octajet here and you peel the label off. Now this is a sharp, so we want to keep it in the container when we attach it to our Fibryga vial. So we attach it like so. Okay, so now we remove the covering, and just remember, once again, this is sharp. So we have our clean lid here with our sterile water. We're now going to pop it on to the top here and pierce it, and it will leak a little bit, and that's normal. If it does leak, just keep the seal tight. Now you'll notice the water won't flow until I remove this ring, and then the water will pour into the Fibryga bottle. Okay, so now all my water has transferred into the vial with the powder. I'm gonna take this off, so just remember this is a sharp. It can take up to 5 to 30 minutes to reconstitute the Fibryga, so all the more important reasoning to get it ordered quick and to have someone designated to mix the vials, and if you can mix them simultaneously, that'd be best. So now that our Fibryga is mixed, we need to grab our particle filter, pop it on a 50 ml syringe, and we're going to remove our blue top of the Octajet, leaving this blue piece on the top. These now connect blue to blue, and I can draw up my Fibryga into my 50 ml syringe. So if the patient is needing less than 1 gram, we can actually push the Fibryga just with the syringe, slowly. Or if we need to pool it, we can pool it into our sterile Baxter fillable bag and flush it with saline after it's gone through the Baxter pump. So there we go, there's my Fibryga in my syringe. They do recommend for each vial that we use, you use a separate 50 ml syringe with filter to keep it as sterile as possible. It is now at 20 milligrams per ml, so depending on the dose, if it's less than a gram, like I'd mentioned before, I can give it IV push slowly, or I can take my 50 ml syringes of Fibryga and pool it into a bag and deliver it through the Baxter pump. If you're ever in a pinch and need help with reconstituting this product, there is also a hyperlink to a YouTube video through eyesight on the Fibryga information sheet.
In conclusion, just a few pearls about Fibryga. First of all, cryoprecipitate is out, Fibryga is in, so Fibryga concentrate by the Fibryga name brand. The important information is found on the inside net. Just Google Fibryga, follow the links on the line. There is a blue hyperlink in the Fibryga module as well, which gives more information on the product. Other pearls is that when reconstituting, it's a swirl, not a shake. Maximum dose is 4 grams. That's for both adults and for kids. Reconstituted, the vials are 20 milligram per ml concentration, and the maximum rate is 20 mils per minute. So essentially, you could give a full 4 grams of Fibryga over 10 minutes, if that's the case. It's really important as part of our component therapy for bleeding patients, especially in trauma, to help stabilize clots and help them to form clots and replace their depleted fibrinogen levels. Other things is that it is to be swirled. Oh, poop. Is replacing the concentrate. Oh darn! It's
won't go in right away. Oh, as I'm leaking it, we need to actually remove this ring, which is not happening. We're going to remove this device here. So I just, once again, use this to try to keep the sharp out of the way there. Oh, wait, never mind, that's not true.